This is the first time we've been in the same room, countless interviews. Amazing to shake your hand. Can we acknowledge that moment, how crazy it is that it's been 5 years?
It feels like it's been so long ago, but at the same time, for me at least, it feels like it was just kind of yesterday in many, many ways. But you and I shared a lot of conversations. Everything was virtual. I kind of feel like we got to know each other in ways that, we wouldn't have otherwise been able to if we hadn't been able to spend that time. So to have this opportunity to be face to face and to think about some of the things that we did together and some of the things that we tried to do in service to the community is a great opportunity. Thank you.
How are you?
You know what? I'm good. I'm good. Our family's good. And I have nothing but gratefulness for kind of where things are at this point. We're very fortunate in many ways, sort of just looking individually as a family in terms of our health. We have 4 beautiful kids. I really have nothing to complain about, and so looking back at all of that and just kind of just speaking, at a very basic level, I am incredibly grateful. At the same time, I realize now more than ever that inequality and challenges with our marginalized, vulnerable populations continue to be significant, and COVID really drove, that inequality even more. And I think we're seeing many aspects of that, and that's what myself and, the colleagues that I work with day to day continue to try to serve that population and continue to try to serve. And, so that's what I've been doing the last 3 years that I've been radio silent.
So take me back to kind of 2 years ago when you really did pull back. You stopped doing interviews. We would ask. You would politely decline. You weren't ignoring us by any means. But What happened?
Truthfully, I was just tired. I was just really tired. And, there was a cost just purely from a time perspective in terms of wanting to make certain that when I was doing all of that stuff and being public facing and trying to provide information and trying to convey both certainty and uncertainty to the public, that I needed to do the best that I could to be as up to date and as current on all the information as possible. And that just in and of itself was an incredibly time-consuming thing to do. So it wasn't something that was done just kind of frivolously. There was a responsibility there of like, what, people are listening, and there's probably going to be some proportion of people who are really going to take what it is that I say probably seriously. And so taking that responsibility seriously was important, right? And trying to convey the scientific evidence as best as possible and the uncertainty as well. A lot of people talk about how, as we moved through the pandemic, that it became more challenging, right? As public health pieces and policy pieces and political pieces all started to kind of diverge a little bit. And that was definitely tough. I think, for all of us on the front lines providing healthcare, on the front lines, and for all of us who are trying to advocate with regards to the public health pieces and trying to help keep people safe. I mean, we were just all, I think, doing the best that we could. And we realized that there were, bigger pieces around policy and political dynamics, which we probably had limited to no control over at the end of the day. But I think at a base level, for most of us on the front lines, we were just trying to support each other as best as we could. It was a really, really hard time, and there were times where it felt like we just couldn't do any more than we did, and people were still having bad outcomes, dying, and there was just so much tragedy. And so dealing with all of that, I think, was also obviously exhausting. And, so I think the sum total of it all, kind of when we got through sort of into February, March 2022, when all the mandate stuff kind of ended and there's all the stuff going on in Ottawa and just a lot of just tension and energy and just bad vibes across the board. It felt at that point in time like things were mostly kind of done, that the narrative was probably kind of done to some degree in terms of, where we were kind of moving forward with. Policy had sort of been decided. And I think for me and I think for a lot of my colleagues, we just needed a bit of a break.
That's fair.
So, yeah, that's basically all there was. But it's not like I stopped doing what I was doing in terms of my day-to-day life. And I continue to basically, be as engaged as I ever was, both clinically as well as, with teaching and with research pieces and with trying to help advocate and support people, who don't have a voice. That's why I continue to do what I do.
What do you remember about the earliest days of the pandemic? If I say the words 2 weeks to flatten the curve, that may take you back.
Yeah, that period of time in March, like literally 5 years ago, not quite, but close, was an incredible time. There was there was a lot of fear. I had a lot of fear and a lot of anxiety because we saw in certain parts of the world, right, that things were just really kind of happening really fast. Health systems were collapsing very quickly. Like there were a lot of people dying and systems were being overwhelmed. And we obviously here and everywhere else kind of had that vision in our heads of things collapsing, right? Too many people, too many patients, not enough resources, like what were we going to do? So a lot of what happened in that first 2-3 weeks in March was about trying to plan, and that wasn't necessarily me directly, that was our sort of SHA leadership ministry, trying to plan and figure out like, okay, how are we going to mobilize our teams and ration resources and figure all this kind of stuff out, right? And I remember the thing that sticks out probably more than anything from me was that I received a slide deck from a colleague of mine, Nate Osgood, and he had shared some modeling data that he had put forward to, I think, ministry officials and SHA leadership, basically that showed that we were going to get crushed, like the system was going to get crushed. And I read that and I just felt this horrible pit in my stomach. I was sitting on the sofa, my kids were sleeping. It was probably like 9:30 at night or something like that. And it was probably like around like March 24th or March 25th or something in that time frame. And I just thought to myself, man, is this over? Like, are we kind of done here, right? And so there was a lot of fear and a lot of anxiety. But at the same time, I also realized that at a service level, that this was what we had signed up to do. This was my responsibility to provide service. This is what we signed up to do. This is not the time that you run. This is the time that you stand and you stand with your colleagues, and you're there to provide service, and you're there to look after the people that need our help, and that's what we continue to try to do over the course of the entire pandemic. And my service was not only, I guess, on the front line, but with some of this stuff that we did together as well.
It's interesting, though, as you say, you had a lot of fear. You never relayed that to us, even in conversations we had off camera. And I don't know that a lot of physicians did. I don't think I heard a lot of, I'm scared. And I don't know, is that something that you felt a responsibility to stiff upper lip and keep that, we'll figure it out mantra?
Yeah, I think when I started kind of doing some of the stuff with Stephanie on the morning edition, we started doing these like call-in sessions. It was probably like an hour or something like that. Chris was probably producing some of this stuff. And it was probably around, I think maybe 3rd, 4th week of April when we started doing that. And it felt like we did it like weekly. And during that time, I also did something. I think I got invited to do The Current, and Current's one of my favorite radio shows, right? And so to get an opportunity to actually get on The Current and to be on The Current was just like, I thought this is like the highlight of my life, right? But they asked me like on The Current, it's like what is your sense of like how all this is going? I talked about some of the fear that I had going into a room, for the first time with a COVID positive person, and I was all gowned up and I was a little bit anxious, there's no question. But again, to show that anxiety and to show that I don't know, a lack of certainty, right? To my colleagues, to the people around me who were looking to me again as someone who was supposed to be knowledgeable and supposed to be, sort of aware and understanding like what was going on at the time. And then of course to the patient, that you're looking after, like that all can convey sort of things that you don't necessarily want to feel, right? So I think what I tried to do when I was public facing was to be open and to be honest and to never overstate anything and to say like, you know what, I don't really know the answer to this, or actually we don't know the answer to this, right? There's a lot of uncertainty here. But there were a couple times I remember where I kind of broke down a little. There was once where I talked to Bonnie Allen, and it was about that was right in sort of September 2021 during Delta. We were getting crushed and we were talking about, again, getting people out of here. We had no ICU capacity. I kind of broke down. That I think is still up online. And I almost started just frankly just bawling, right? I kind of kept it together, but Bonnie could see that I was struggling because it was such a hard time. And, there were a couple podcasts that I did with Jen Quinnell, who I don't know that she works for CBC anymore, but she was at the time working, I think, with CBC Saskatchewan. And I did a couple podcasts with her, and it was kind of the same, just kind of reliving some of those moments. And again, we were trying so hard to kind of advocate and to try to get some of that messaging out. And it got progressively harder and harder because you felt like it was like there was a tide of things kind of working against you, so to speak, right?
It's telling to me that you, an infectious disease doctor, was anxious and maybe even scared walking into a room with a COVID patient. Like, that's telling to me because you have studied and understand some of the most scary things out there that can kill people on the regular.
Yep. There was just so much we didn't know at that time. And, that I wouldn't say it faded, but obviously it sort of became normalized as we saw more and more people, and we kind of realized that, this is not some sort of killer disease. Again, it was largely a viral process that affected people in ways that many other respiratory viruses do. It's just, again, there was so much uncertainty, and then all these irrational thoughts kind of come into your brain. And I'm not immune to any of that, right? Thinking about, well, what if I get sick? What if I bring it home to my family? And what if I get my wife and my kids sick or my friends sick? Like, how's that all going to look? Like, what is this all? There's all these uncertainties, right? But I mean, when push comes to shove, as a healthcare provider and at a level of service, I think you have to realize that you kind of have to put that a bit aside. And that got easier and easier as we kind of moved through the pandemic and began to understand sort of, more about the virus and, and how it was transmitted and how we could protect ourselves.
Oh, we don't have to wash our groceries anymore?
Yeah. I mean, I still wish we had hand washing stations at Superstore, but yeah, such is life.
Okay.
Yeah.
I didn't realize until very recently that you're married to a registered nurse. I'm sure it went in one ear and out the other at some point. Walk me through what it was like raising very young kids, both of you healthcare workers, and also you being public facing. When was that like?
Well, it was definitely not an easy time, but at the same time, we were extremely fortunate to be privileged to have access to financial resources. Her family's here in Regina, able to support some stuff. And daycare's closed for a short period of time, but then they reopened for essential workers, right? And I was considered an essential worker because I was a healthcare provider. So I was fortunate that she and I were able to continue to work and that we had a place, where our two boys could go at that time. And I remember literally in the daycare that we're still at that daycare, and they've looked after all four of our kids up in the north end of the city. And like they were the only two kids, right? So they had a skeleton staff, and it was just literally the two of them there all day, and there was nobody else, right? And I have this video on my phone of them running down the hallway, and everything was kind of like locked off and stuff like that. And it was literally just the two of them and one of the daycare workers who's still there. So yeah, it was a crazy time, and at the same time, we had a tremendous amount of privilege as well, like to be able to again have access to the financial resources that we needed to be able to kind of like shelter in place and stay safe and so on and so forth. So I'm grateful for that. We had our daughter Lauren in August of 2020, basically during COVID. So it was a little bit of more of a challenge for her, but again, I think we were lucky that a lot of they were young enough that they weren't necessarily right into school yet. They didn't miss a lot of school. And again, looking back at some of that, again, we obviously closed schools and we didn't necessarily know better. That obviously had impacts that were wide-ranging on mental health-related pieces as well as developmental pieces. We just didn't know better at the time. But I was really fortunate to have my kids be at a point in their lives where they didn't miss out on a ton. And, and since then we've had, another little boy. His name is Sam, and he's doing really well.
It's a great name.
Yeah, Sammy, we call him. And again, I mean, he's just developing just like it never even happened, right? He was born in February of 2023 when it was all kind of done, and you wouldn't even know, to be honest. So again, I look at it all with a degree of, just kind of gratefulness. And at the same time, we realize how hard it was for so many families and so many people. And we never want to forget that either.
What did those kids give you on your hard days?
Yeah, it really gave me, there were some days that were really hard, like long days, a lot of stuff going on in the hospitals and a lot of stuff like with colleagues and just people just struggling and just bad outcomes. I don't even really want to talk about it all because it kind of brings back just a component of just this PTSD related stuff that, we all sort of think about. And we all have our stories of some of the most challenging pieces that we dealt with during all of that, where we basically felt helpless, right? You wanted to do so much, but you saw just young, otherwise healthy people just dying. And there was just nothing we could do. There was no vaccine at that time. This was like, I think, sort of around the time of early 2021 when vaccines were just starting to roll out, but it wasn't necessarily widely available to the general public as of yet. And then our alpha hit, that was kind of when I became a little bit more visible, at least, because it was just kind of devastated us, in that wave. And, so in the end, I just kind of look at all of that. And if I didn't have my family and my kids and my wife and that base of stability to kind of go back to, and I kind of felt, again, like I tried to keep work at work too, which might seem difficult for some people to imagine because, when the kids were sleeping, that's kind of when I did a lot of my stuff on Twitter and social and kind of got sucked into that for a period of time. But again, I did the best and my wife realized that what I was trying to do was, again, like largely around sort of related to my work and public service. And so she supported that. It did get a bit harder as I became a bit more visible and things became a little bit more contentious at times in terms of, people having different ideas and opinions. But it never got to a point where we ever got necessarily where we felt a degree of like physical danger or threats or anything along those lines. And I wouldn't say that it kind of affected my family in any sort of bad or negative way, right?
Oh, I'm glad to hear that.
Yeah, and I was able to let it go, I think, in the end, as it's easy to get sucked into a lot of the stuff that goes back and forth on social media. And I wouldn't say that I ignored it, but at the same time, I didn't internalize it and put it into a situation where it kind of just led to a bad place. I was able to just kind of put it in its place, let it go, kind of move on so that it didn't dramatically affect, I think, my mental health in any significant way.
So you almost had like a bubble over you if there was backlash where you just it just deflected off of you, like you saw it, but you just let it go.
Yeah, and you know what? Again, I don't want to necessarily be dismissive because, again, there was different forms of criticism, right? And
I think there's a difference between criticism and backlash, though.
You're right. I think there's criticism, there's anger, frustration, all these other pieces. And
an emotional time, right?
Emotional time. And so I tried to do the best I could not to allow all of that emotion to really affect me in ways that I didn't want it to affect me, right?
What did your wife say about all of this? Did she ever sit you down and be like, what are you doing?
Yeah, I think just like with anything else, like at the start, like I'd never kind of done this stuff before. Like I'd had a Twitter account and I literally didn't even remember what the password was for it. And so when I remember at the beginning, it was probably the beginning of March 2021, where I was like, this alpha thing is going to get out of hand. And I don't know. So I just decided, I think it was like a weekend morning, either a Saturday morning or a Sunday morning. I was like, I need to say something. So I put it out and I managed to log into my Twitter and I wrote something up. And I think some of the first few people that I messaged were like Stephanie, for example, like with CBC and, someone like some of the political folks who I knew to try to just kind of put that out a little bit more. And it became just like I think it would be for anyone a little bit of an obsession, right? Because I was getting all of this, all of these likes and follows and subscriptions.
Dopamine
and
hit after dopamine hit.
Absolutely, right? I mean, my phone literally just crashed like with nonstop. And so I had to turn all of that off, but there's no question that there was a part of it which was just, you kind of get sucked into that just because I don't think anybody could avoid getting sucked into that. It moved quickly probably through the fall to a point where it became more sort of a view towards public service. And I had moved away from all of the never-ending dopamine hits and so forth and just moved to a place where it was more around public service. But at that point, I felt like some of the stuff was getting a little bit more high stakes. Like I was doing live stuff on Power and Politics or, on the various kind of, sort of talk shows for CTV and CBC. I was on The National, obviously. Those were generally pre-recorded sessions, although there were a couple sessions that were live. And so, again, a little bit more high stakes, and it felt like, again, it was just more important for me to just, be responsible and make sure that I take that responsibility seriously. But I don't miss it. And I realized, again, as I was moving into January, February, when everything was moving forward with, Omicron, and we knew that, all the measures were going to come to an end and so forth, I had some stuff happen physically where, I realized that was probably just, again, a significant physical manifestation of stress and just not taking care of myself, not taking care of my mental health and my body. And I realized that, I needed to let some of this stuff go, right? Just purely from a time perspective.
Okay, so let's talk about that. I think of this as when the wheels start to fall off, mentally or physically.
Yep.
When did your wheels start to fall off? And how? How did it manifest for you?
Yeah, I don't think anybody really ever actually saw my wheels fall off, either at work or, kind of in a public-facing setting. But like around mid-January or so, somewhere around that time, something happened to my body, and I just started like not being able to like really walk. It felt like my body had sort of seized up. And I didn't know what was going on, right? So I just kind of woke up and everything kind of seized up. I couldn't really walk very well. Everything was super tight. And so I went to physio and, I couldn't work. I had to take a couple weeks off. And I was really struggling. Like I was in a lot of pain and couldn't really do much of anything. And again, in hindsight, all of that was most likely sort of physical manifestation of just stress, of stress. And that was around mid to late January of 2022. A lot of things were moving at that time with regards to Omicron measures. We were still getting hit really, really hard in the healthcare system. In some ways there was more pressure than ever because that was, again, sort of, I felt a certain degree of pressure because there was this significant divergence at that point with regards to politics and policy and sort of what the public health leaders were saying. And it was like, oh, well, you're saying this, but they're saying that, right? And so that, again, I didn't realize it. You never really totally realize a lot of these things at the time, but looking back at it, yeah, that probably was kind of the beginning of the end for me at least, right?
How'd you fix it?
It was actually a massage therapist who actually saved me. And my wife had worked with her. She actually came to the house and, she, I guess, knew me from like all the stuff. And she respected some of the things that I had said and some of the things that I had done. And she basically got me unstuck, but it was painful. Like she worked on me in terms of just muscles and just kind of just starting to move properly again and getting everything kind of unstuck. And then, so yeah, I have her to thank. I won't mention her name, but she helped to get me going again.
Does she know that she fixed you?
Oh yeah, she totally knows. Oh yeah, I credit her, and I'm mindful now of some of the things that I need to do physically and from an exercise perspective and even from a mental health perspective that help to keep me away from that kind of place. But, like when your body's not cooperating, it can be a very frustrating thing, right?
Oh, yeah.
So I was clearly frustrated with all of that. So that was part of it. And then, like I say, things were moving in a way that just felt inevitable. And to that end, I just thought, you know what, time to move on and time to get back to my regular work.
How long did it take for your mind and your body and your routines to feel like your own again? Because I feel like when you get sucked into the vacuum that can be the media, especially in that time, it can be hard to be like, what did I do before this? So how long did it take you to fall back into, I mean, you had more children, those kinds of things, but how long did it take for you to feel like your body, your mind, your routines were your own?
Honestly, I don't think it took me that long because there was a natural slowdown during COVID with a lot of stuff, certainly at the start, like in March, April, everything just shut down basically. And so there was a bit more time because there weren't as many patients and not as much clinically to do. And so there was a bit of an opportunity to balance things. But I mean, I have no shortage of work. And so I ended up kind of throwing myself kind of back into a lot of this stuff, which I knew was my core basic sort of function day to day in terms of, providing support for persons with infections, for persons with, sexually transmitted infections, bloodborne infections. I got sort of much more sort of deep and sucked in to, sort of helping and supporting, people living with various forms of substance use disorder, which is a large part of my practice now. And so I was just able to shift, all of the energy that I had. And I had gotten enough of it. I'd kind of gotten my fill. I'm not going to lie, like when Bonnie helped to kind of get me onto the national, for the first time, and I was able to talk to Ian Hennemansing, and I was on with Fatima, who's a good friend of mine, Dr. Kakar, who's a pediatrician in Montreal. We did our first session together. And that was just such a huge ego stroke, right? Like I'm not immune to all of those things. So, to have even had those kinds of opportunities to be able to, engage with people like everyone in the media, just kind of meeting some folks today, like you and Chris and Stephanie and Adam and all these folks at Bonnie, at CBC that I spent a lot of time with. We all played our various roles, but I think we all played really important roles, and we helped to support one another during, that challenging time in terms of supporting, integrity and truth and, trying to ensure some degree of accountability on the part of, like everybody, right? That's what we try to do, I think. So I don't miss any of it. At the same time, if I needed to, I would come back and do, whatever I needed to do. But, I'm hoping at least right now that there won't be a need for me to be a so-called expert, in anything, for the foreseeable future.
How are your boundaries? I mean, you said yes to me, which is lovely, but you've said no to other things we've asked of you. But how do you keep those boundaries in place? How do you pick and choose now to keep this new world order of yours in place?
You know what? I don't have really any I don't have any agenda, to be honest with you. When you reached out, I kind of saw it as just, I don't know. I mean, we're not friends, but if not friends, we're kind of close colleagues, I would say. And there was a degree of trust and back and forth, in terms of how we did things during that time, which I at least had a tremendous amount of respect for. And again, I don't let that stuff go easily, right? So I look at all of that and I look back at all of those, not only what we did kind of on air and what got aired, but kind of a lot of the planning and, discussion that kind of went on behind the scenes, because at times it was complicated. There was just a lot of complicated stuff, and you couldn't just dive right into it and speak without being thoughtful and perhaps having a bit of a plan, right? It just wasn't really a smart thing to do. So I don't really have any agenda. I don't want to look at all of that time again as anything that I necessarily want to hang my hat on, but I do feel a bit of a sense of pride that I was able to provide hopefully a degree of public service that people found helpful, and that I didn't, make a complete ass of myself either in the process. And I really did try to do the best that I could. And I'm not going to lie, again, there was an ego component, certainly for the first few months, right? But I've been able to kind of move past that. And so I think I'm ready to engage if and when the opportunity arises and if it's needed. And at the same time, I don't miss it either, right? And so, yeah.
So let's talk about where your focus is now. You have moved on from COVID, but you've not moved into H5N1. You're not a bird flu guy.
Not yet.
Not yet.
Not yet.
But what are you focusing on now?
Well, I mean, there's work and then there's home, and then that's kind of it, right? That's my life. I mean, so at work, we continue to work at the General. We have our ID clinic, great interdisciplinary team, pharmacy, nursing, social work, research. None of that's fundamentally different, and we continue to provide service as best as we can to, all persons that need it. We have obviously a very disproportionate number of individuals who, are often marginalized, vulnerable, and, who lack good access. And, so our responsibility is, to advocate and to support those people, not only from a medical perspective, but also, from a life perspective too. So we do the best we can. So that's my core function at work, right? And then obviously I do my hospital-based work as well. When I'm not in clinic, I'm on call, 10 to 12 weeks of the year where I'm seeing people in hospital, just like I did during COVID. None of that has changed. I still am, researching and engaged in clinical studies and trials for things like HIV and hepatitis and, all these other types of things. That hasn't changed. So, and we're moving forward with some, I spent a lot of time in 2023 and 2024 helping to support some work, in our various correctional settings here in Regina, trying to improve like substance use disorder related care and so forth. So there's various initiatives kind of going on there with, some federal funding and so forth. So that's work, and that is still incredibly busy and in many, many ways very rewarding. I just see that at a system level, I would say that the system does continue to struggle. I mean, we lost a lot of good people during COVID, and I think the system is
by
still...
nature of quitting. They didn't die.
Yeah, no, just by nature of quitting.
Yes.
And just the fact that just so many of our good people just went so hard that they just had nothing left to give, when it was all said and done. And again, for a lot of us, a relative degree of moral trauma, moral injury probably played a role in some of those people moving on to either leaving healthcare or retiring and so forth. And I think the system is still trying to recover from all of that even today, like 2-3 years after the fact when everything kind of became pseudo-normal again, right? But that's always going to be a huge part of, my identity is the work that I do. But, when I'm at home, time with family, time with my wife, and recognizing that piece is also incredibly important. And I try to carve out, 2-3 hours a day, when I get home, just where unless there's some horrible deadline that I've got to meet or something like this, where I'm with my kids, I'm with my family, understanding the importance of just, protected time where I'm with them and they know that I'm with them, so that I can listen, support, try to be a good dad, try to be a good role model, right?
Human jungle gym.
Yeah, but and I see work as a function to some degree of, again, setting a good example for my kids, in terms of the day-to-day work that I do. And then obviously things of this sort and just, again, trying to be of service. I mean, that was kind of, again, why I chose to do what I do and why I continue to do what I do. And that is kind of the core element of who I am. And that's kind of how I want to try to raise my kids to try to be as good human beings, right? So setting that example, is also important, I think, for me. So it isn't any different than what it was like when I was public facing. I think everything that I did public facing was just essentially a reflection of who I am as a person and as a professional. And that's why I was able to make it work, I think, and not able to make a fool of myself, because I never really, it was all normal and natural. It was just kind of trying to just be open and vulnerable and, try to not have that ego, basically, when I was public facing.
I know that you don't love talking about COVID times, that it's not your preference. It's not a memory lane that you particularly like to go down. But when you consider everything, how has this all changed you?
Well, for starters, I got through it. And that's not a trivial thing. Like, I know a lot of healthcare providers and a lot of healthcare leaders and a lot of people sort of, who are doing sort of public facing type work and public service at that time who didn't really get through it or who really struggled, in a lot of ways. I try to look at life again as a series of challenges and opportunities and, ways to grow, right? And, so a lot of what we did was just putting myself into a lot of challenging situations and trying to emerge like smarter, better, stronger, more adaptable and so forth. But it was a really tiring time too. And it took time to recover from all of that. So I'm grateful that it all kind of ended up the way that it did for myself and my family, in the sense that we didn't have any direct impacts with regards to health consequences, family, and so forth. But we were kind of in a minority of sorts. Plus, at the same time, we had this degree of financial economic privilege, which, many others did not, right? So it's kind of said now that COVID was not such a bad time for those, who had the means to be able to kind of, and so forth. And it was a much more challenging time, obviously, for those who are vulnerable and those who, are economically and financially disadvantaged. And at a societal level, COVID has probably, again, driven those disparities, even further sort of, and again, I don't want to get into all of it at this point in time, but it's kind of left society, I think, in a more challenged place in many ways, and we're seeing some of those manifestations day to day now with some of the dynamics happening not only here in Canada but around the world, which again I don't want to necessarily get started with, right? That's not our place to talk about, but this is kind of where we are. And so I don't know, I think trying to get back to a place, again, not so simple, where we can focus on essentially, being good human beings, helping to look after one another. And, also recognizing at the time when you have enough and when you have this degree of privilege from a financial economic perspective, that, the core of being a good person and a good human being is supporting those who are in need, I think. And I think COVID drove a degree of individualism, which is stronger now, and a degree of kind of, us against the world, which is kind of stronger now than it was before. Which is sad, because when we started with COVID, remember the unity we had and, like trying
Banging
to do the
pots
right thing.
for healthcare workers at 7 p.m.
And, stick it to COVID and, people that we were all trying to band together. And it's amazing how we moved so far away from that so quickly in a lot of ways. So I think for me, trying to help advocate for a place where we can move back to some of that. And again, we're seeing some of that as a country, I think, with some of the current dynamics, but again, I don't want to be so presumptuous as to say, oh, we should do this, we should do that. those of us who have a degree of economic privilege and freedom, it's easy for us to say, but at the same time, I think we got to sort of put our money where our mouth is too. And so that's some of the stuff that's kind of on my mind right now, and some of the work that I do day to day supports that. But then again, trying to support, people who are in need and who, require those supports continues to be really, really important.
So it really hammered home for you. The work that you had started doing before COVID has become even more important.
Yeah, and it's nothing fundamentally has changed. And I wouldn't necessarily, I think some aspects perhaps have gotten perhaps a little bit better from a medical perspective in terms of some of these pieces around addictions and overdoses and so forth, but nothing has really fundamentally changed. Our HIV rates are still, the highest, if not the second highest in the country. Manitoba might actually be higher than us in 2024. Again, overdoses have come down a little. That isn't necessarily as a result of anything that has to do with programming or any kind of plan or dynamics. It just has to do with the street supply and the fact that the relative potency of, opioids and fentanyl and so forth are just has been less, in 2024 compared to 2023. So we've just had less fatal overdoses and less non-fatal overdoses. But just this past few days, there's been a spat of overdoses in Saskatoon, for example. So there must be something in the supply now that's quite toxic. And so these are pieces where I think we continue to work and advocate and, hopefully, get some buy-in, I think, from our elected officials and from our ministry to be able to come up with a more concerted plan on moving this forward and take it away from some of the policy and rhetoric pieces and just focus on just doing the right thing for patients, which is always in the end, I think, in my mind, the right thing to do.
Thank you for doing this. And for the vulnerable moments, I know that there is a stiff upper lip component that comes with being a doctor, but I appreciate it. And thanks for all the help that you provided through those dark and uncertain times, because a lot of people really appreciated the help that you gave, and I hope that you felt that.
I hope that people felt that it was helpful in some way, and I'm grateful to have had the opportunity to kind of earn people's trust and respect. And maybe that time will come again at some point, but if it doesn't,
let's hope not.
If it doesn't, I won't shed a tear. But thank you again, Sam. And I wouldn't have done this if it hadn't been for a lot of the interactions that we had during that time. And so there's a lot of mutual respect there. So again, I appreciate that opportunity and this opportunity as well.
Thank you so much.